Hi everyone, my name is Woosuk and I'm a PhD student at University of Michigan. Today, I'm going to present our study about designing technology to support effective child-patient provider communication based on healthcare providers' communication strategies. In the pediatric care context, having effective communication with child-patient is challenging for healthcare providers. Existing communication guidelines and training for providers often focus on general communication skills for interacting with child patients, and have less concentration on providers' unique challenges to have effective communication with child patients who have different personalities, preferences, and needs. Also, poor communication hinders providers from accurately assessing child patients' symptoms. As a result, healthcare providers have to frequently develop their own communication skills to interact with children effectively. Acknowledging these challenges, we conducted a qualitative study that focused on the following research questions. First, what are the key elements of effective communication that providers value when they interact with child patients? Second, how do providers strategically interact with child patients to accomplish effective communication during clinic visits? Third, how can technology support healthcare providers' communication strategic development? To answer these questions, we conducted 12 field observation sessions and 10 semi-structured interviews with healthcare providers at an urban children's hospital. Based on the collected data, we found 4 communication strategies. The first strategy is building rapport with children. For instance, providers in our study explained what they would do to the children before their actions, such as having physical exam or giving injections. In this way, children know what to expect for the medical procedures and consider providers as someone trustful and build rapport with them. The second strategy is developing children's familiarity with care settings and Luteinizing clinical procedures. Children would meet the same care team members, have the same order of treatment procedures, and communicate in the same method as their last visit. This structured hospital care process would allow children to be more familiar with care settings and clinical procedures. The third strategy is respecting and adopting children's communication preferences. For instance, a provider in our study met a child who refused to talk to the care team. So the provider asked the question to the stuffed dog that the child brought. Then the child began to answer for the dog, reflecting his own preference and needs. The last strategy is delegating small decisions and inviting children to conversations. Providers directly asked children about which arm they prefer to have injections or where they want to sit during consultations. Such small decisions are not essential to the treatment decisions, but relevant enough to allow the children to feel a sense of control during clinic visits. Based on these 4 strategies, we found 3 elements of effective communication that providers value in the pediatric care context: transparency, respect of sentence, and empowerment. Transparency refers to providing transparent information about clinicians and their actions, rather than simply providing access to the detailed medical information. Respect and acceptance indicates adopting each child's specific language and communication styles. Empowerment means helping children to control over their care at their perceptual level. To promote providers' strategies for accomplishing these 3 elements, we present the following design consideration for technology. Among these 3, I would like to introduce the first consideration, facilitating patients' familiarity with providers and the care setting. An example for this consideration is mobile application that collects patients' information, such as their favorite character, foods, activity, and personal interests. Then it shares the information with the providers after having patients' consent. For the patient, the app can provide brief heads up about the care team members and treatment procedures before talking to the provider. So the app promotes rapport building by providing transparent information to the child patients. And I would like to thank my wonderful co-authors listed here, and thank you everyone for watching.